to have it filled out. So we're gonna do this one as insurance. So if it's ever my account or client, my account stands for the doctor's account, client bill stands for the doctor's account, or if it's self-pay, patient's gonna pay out of pocket because they don't have insurance, those do not require a diagnosis code. If it's insurance, it does require a diagnosis code, because a diagnosis code is basically a code that stands for, just like hypertension. Instead of writing hypertension out, you're gonna use a code. I don't know what the code is for hypertension. I used to know all the full ICD-9 codes, but now it's changed to 10s, and I haven't been in the field working, so I don't know. But I'll show y'all how to look up codes. It's not for you to memorize codes. It's not for you to even assign codes. But if a doctor gives you a requisition and the patient has insurance and he does not have codes on there, you need to give it back to him and tell him to put some codes on there. Usually when you're working in the office, the doctor, you typically use the same codes over and over again, and sometimes he's going to tell you, hey, put a code for hypertension and vitamin D deficiency on there. So with insurance, when you're using codes, so if I'm doing a lipid panel on somebody to check their cholesterol, I don't need to use a diabetes code. I need to use a code that's medically relevant to whatever I'm testing for. Does that make sense? So one universal code is Z00.00. That stands for a physical code. So when you go for your annual physical, just about any blood work they do up under there will be covered by the insurance, because that's your annual physical exam. So again, I will show y'all how to Google codes, because when I give you a requisition to take and fill out, and you need to get creative, and like I said, my suggestion is you start at the top and work your way down. A lot of times people are skipping over the most important thing that we gotta have, and this is not the best requisition, so I'll have to get y'all a better requisition. But the most important thing besides the patient's information that we're gonna have is the collection date and time. Total volume refers to if we're doing a 24-hour urine. We'll talk about that later. And you always want to ask the patient, are they fasting or not? So I've already got some stuff filled out on here. What did you say your date of birth was? June 8th. And then it's always last name, first name. So I'll look up some codes in a minute. So basically on here we have a CMP, or a comprehensive metabolic panel. What color tube is that going to be in?
Say it again.
A comprehensive metabolic panel. All panels are in what tube?
Oh, they're in a lot. No,
With the purple color.
light blue.
Okay.
Sorry.
If we're going to be guessing, we're going to